Gastrointestinal bleeding from metastatic melanoma. Definition: melanoma shows a particular predilection in involving small intestine, but in a single site and in multiple localizations and occur on journey. Gastrointestinal bleeding are often the first sign of tumor.
Hi, we're going to be talking about patients who present to the emergency department with concern for gastrointestinal bleeding. So we can go ahead and start out with a case study. So this is a 45-year-old gentleman who presents to the emergency department with concern for 2 days of black stool and a lightheaded sensation. When we're thinking about this, we want to ask, where is the patient bleeding from? And also, what are the key emergency department interventions for this patient? So when we think about patients who present to the emergency department with GI bleed, we oftentimes divide bleeding up into the upper GI tract or the lower GI tract. The other thing that's important to remember is that we always start with our ABCs. So in situations of GI bleeding, the A and the B, you want to make sure that the patient has a patent airway, that they're breathing okay, and then especially in a situation of bleeding, focusing on that circulation component. So again, we're dividing our GI bleeding into upper GI bleeding and lower GI bleeding. And where is the dividing line here? For the most part, upper GI bleeding is bleeding that takes place from the stomach or from the upper portions of the small intestine. For lower GI,
Application is nurse. Enterorrhagia is a common sign in patients who come to a surgical department after the exclusion of benign disease.
Imagine this. You find out you're bleeding internally, and the only way to stop it is a big operation. Then your doctor tells you it's so risky you might not make it off the table. That's what the man you're about to meet faced until doctors at Mayo Clinic tried a less invasive experimental procedure. The technology allows doctors to see and reach inside the body where they couldn't before.
Well, it was high risk. We had not done it before.
In a procedure room like this, Mayo Clinic Dr. Michael Levy and his team used two standard technologies in a new way to stop Bill Janicek from bleeding to death. You see, chronic pancreatitis caused a ballooning of blood to form on Bill's pancreas.
You can see the blood flow within the pseudoaneurysm.
Usually, patients like Bill go to surgery, but he was too sick. If he did have the operation and lived through it, life could be very different.
I'll have to have a feeding tube for a while. Maybe at one point in time I can, eat soft liquids between my gallon jug of nutrient for the day, and that really isn't living. I don't want to do that.
So Bill agreed to be the first person ever to have a pancreatic pseudoaneurysm treated with ultrasound-guided endoscopy. The technology allows doctors to reach areas of the digestive tract you can't see with the traditional scope. In Bill's case, the stomach wall would have been a barrier.
What's different about an
Pros and cons. Computed tomography that capsular endoscopy should be complementary for the evaluation of patients with gastrointestinal symptoms and an history of melanoma.
In this video, we're going to look at different causes of upper GI bleeding. So essentially from your mouth all the way down to the duodenum. And bleeds around these areas can cause the patient to vomit up blood, so hematoemesis. So now let us look at some common causes of upper GI bleeding, beginning with esophagitis, which is essentially inflammation of the esophagus. So here we have the stomach, and here we have an inflamed esophagus. And there are different types of esophagitis. We can have reflux esophagitis, GORD, infective esophagitis. Chemical irritants can cause inflammation of the esophagus, as well as there's eosinophilic esophagitis. And essentially, again, it's this inflammation of the esophagus. But while we're talking about esophagus, let's let's talk about Barrett's esophagus. And Barrett's esophagus is a condition where cells lining the lower esophagus change morphology. So the esophagus can be divided into three parts. The last part, the third part, the cells that line this area essentially change in shape. So here in this area, we normally have squamous epithelial cells, but these change to Barrett's metaplasia, which can subsequently lead to adenocarcinoma of the esophagus. So the relevance of Barrett's esophagus is that change in morphology can lead to adenocarcinoma, and also pathological findings reveal that there are goblet cells present in the area where they shouldn't be. The next condition we're going to talk about is esophageal varices. So here we have the stomach again, and here
Issue applied to Ecuador. We report 2 cases of metastasis of malignant melanoma, one present with only a bit mass that cause intestinal obstruction, and the other with a tumor spread throughout the small intestine that produces enterorrhea.
Today we are pleased to have Dr. Lauren Lane joining us from Yale for a discussion on upper GI disease. Dr. Lane is a professor of medicine at Yale University. He received his medical degrees from the University of California, Los Angeles, where he stayed on for his internal medicine residency. He completed his fellowship in gastroenterology at UCSD. Dr. Lane is a former professor and chair of the American College of Gastroenterology Association. He has published extensively on upper GI bleeding in such high-impact journals as JAMA, Internal Medicine, Gastroenterology, and most recently the New England Journal of Medicine. Please join me in welcoming Dr. Lane.
Well, thank you very much. It's great to be back here at Mount Sinai talking about one of my favorite topics, which is upper GI bleeding. And here's my disclosure. And basically what I was going to do today, kind of in 3 steps, is first talk about how we initially assess and manage people who come in with upper GI bleeding just in general, and then spend the rest of the time talking about the management of the 2 most important causes of GI bleeding, bleeding ulcers and bleeding varices, kind of non-variceal and variceal bleeding. And what I'd like to do is kind of take us through kind of how we manage a patient, from the first time, the first moment that they come into, let's say, the emergency department with complaints of GI bleeding, kind of all the way through their management through the hospital and then out the door. So first, what are the manifestations of upper GI bleeding? And today we're going to be talking really about people who have overt upper GI bleeding, not people who come in with symptoms of an iron deficiency anemia and occult bleeding. So hematemesis is vomiting blood or coffee grounds, and that means it's an upper GI bleed, obviously, if it's a GI bleeding source. Now, melon, black tarry stool, hematochezia, red or maroon stuff coming out from below. Melon is usually an upper GI bleed, and hematochezia is usually a lower GI bleed. But the color that's coming out from below really doesn't relate to where the blood is coming from. It relates to how long the blood has been in the GI tract. And many years ago, I always like to tell people about these studies they did in, quote, volunteers. They would instill blood in different parts of their GI tract, and then they'd kind of just sit around and...
Conclusion. Several studies suggest metastasectomy to achieve both result and palliative resolution of acute symptoms such as obstruction, pain, and bleeding.
Acute GIT bleeding can present as hematemesis. Hematemesis is the vomiting of blood or altered blood which looks like coffee grounds, and this indicates bleeding proximal to the ligament of threads. It can also present as melena. Melena is the passage of black altered blood per rectum, usually indicating bleeding proximal to the ligament of threads, but may be as distal as ascending colon. GI bleeding can present as hematochezia. Hematochezia refers to bright red or maroon rectal bleeding, usually implying bleeding beyond the ligament of threads, all due to rapid upper gastrointestinal bleeding of more than 1,000 milliliters. These patients can also have symptoms of blood loss such as lightheadedness and also positive fecal blood tests